Detecting and eradicating cancer at early stages of development is the key to lowering the cancer death rate. Hi, my name is Bill Lloyd. I'm a biomedical engineering student at the University of Michigan and will be an ESCA student in the fall. I've spent the summer working on an ongoing research project with a team of engineers and clinicians who are using the science and technology of optics to develop methods to improve the early detection of pancreatic cancer. I've been lucky enough to work with Marianne Mysek in her biomedical optics laser laboratory in the BME department. Pancreatic cancer is one of the most deadly forms of cancer. 95% of patients diagnosed with the disease die within 5 years of diagnosis, half within the first 6 months. Here, the video shows the current practice method for diagnosing pancreatic cancer, which is endoscope ultrasound-guided fine needle aspirations, or EUS-FNA. In EUS-FNA, an endoscope with an ultrasound transducer at the tip is passed through the esophagus. When the probe is near the pancreas, ultrasound is used to locate the region of interest for fine needle aspiration. At this point, a hollow needle is inserted into the pancreas, which allows for aspirate collection and removal, brought back through the endoscope to be analyzed by a cytopathologist. Unfortunately, this procedure has several associated problems. A 2009 report of 53 performance studies of EUS-FNA showed that the test cannot rule out malignancy with adequate reliability. This is shown by the negative predictive value of only 72%. This is an unmet clinical need. Furthermore, it does not address the most common diagnostic dilemma, distinguishing between pancreatic cancer and benign pancreatitis, or inflammation, which frequently coexist. A study having 207 enrolled patients showed that the sensitivity for detecting malignancy in this difficult setting is only 54%. This is unacceptably low, and new, more accurate methods of detection are urgently needed. This is where our method for cancer detection by optical spectroscopy is utilized. You can see in the picture that the same endoscope is used. However, now a fiber optic probe extends from the needle to be placed on the tissue sites of interest. Glow balls of light are pulsed into the tissue for interrogation, with the resulting light detection providing tissue classification through computational analysis. This method works because disease changes the local tissue biochemistry and morphology, of which can be analyzed by the optical reflectance and fluorescence signals remitted from the tissue. Our preliminary results show the capabilities of this approach. During Whipple procedures at the University of Michigan Hospital, resected pancreatic tissue of consenting patients was prepared by surgeons for analysis by a reflectance and fluorescence lifetime spectrometer, or RFLS. Optical measurements were taken from sites on the tissue by the RFLS, after which histological analysis was performed. These collected spectra were used to develop diagnostic algorithms for tissue classification. Even though our detection is still in development, preliminary results show that optics increase the sensitivity to 85% from 54%, as well as raising the negative predictive value to 92% from 72%. These results are very promising for future capabilities, although this work is in an early stage. During this summer, I have spent much of my time investigating a specialized optical technology from Fluorescence Innovations to analyze its capabilities for possible future use in optical tissue diagnostics and incorporation into our clinical device. It meets initial clinical needs of having a small tabletop footprint for portability, as well as collecting information fast, both musts for any technology to progress into a clinical environment. Initial experimentation tests of this technology include studies on tissue simulating phantoms, which are materials that replicate the optical properties of biological tissues. This co-authored work was submitted for an oral presentation at the 2010 meeting of SPIE Photonics West and entitled Clinically Compatible Instrumentation for Accurate Detection of Fluorescence Intensity and Lifetime in Turbid Media. None of this work would have been possible without a dedicated team composed of researchers in biomedical engineering, gastroenterology, surgery, pathology, applied physics, and industry. My thanks to each of them. I would like to leave with one take-home point, that the key for improving cancer survival rate is early and accurate detection. Our hope is that the optical tissue diagnostics will help to improve survival rates for patients with pancreatic cancer. For more information, please visit our website. Thank you for listening to my presentation.